Welcome to episode 12 of our COVID-19 Religion and Belief webinar series. Today, Simona Cruciani from the United Nations Office on Genocide Prevention and Responsibility to Protect will share a panel of distinguished academics and humanitarian experts. You should have received their bios, so we invite you to read them through as we go through this panel. Together, they will look at the contribution of faith-based humanitarian organizations during the pandemic, and how lessons learned can help us in the recovery phase. We look forward to their presentations. Now I invite all panelists and participants to respond to our traditional poll that you see on your screen right now. It will give you and our speakers an idea of our global audience, so we thank you in advance for that. For your information, this webinar is being recorded and live streamed on social media. The recording will be available on our series landing page, where we also publish information about upcoming episodes. You can type your questions or upvote others at any time using the Q&A tool on the bottom of your screen. Please keep your text short and to the point, making it easier for the moderators to pass them on. And if you get disconnected, just use the same link that you have received when you registered to join back in. Finally, I would like to recognize the sponsoring institutions of this webinar series: the Cambridge Institute on Religion and International Studies, the Center for Religious Studies at Bruno Kessler Foundation, the Center for Justice and Society at Fundação Getulio Vargas Law School of Rio de Janeiro, the International Center for Law and Religion Studies at Brigham Young University Law School, the European Union Office of the Church of Jesus Christ of Latter-day Saints, and the University of Siena. I will now broadcast the results of the live poll and hand the panel over to Simona. Simona, the time is yours.
Thank you very much, Francesco, and thank you to all those who have joined this webinar today. My name is Simona Cruciani. I serve as a political affairs officer at the United Nations Office on Genocide Prevention and the Responsibility to Protect in New York in the UN, which is part of the Department of Political and Peacebuilding Affairs. I'm honored to be the chair of this very important and timely webinar today on the role and contribution of the humanitarian faith-based organization in the fight against COVID-19. We have an excellent panel today composed of three distinguished speakers. As Francesco said, you have the bios in front of you, but I would like to say just a couple of words about each of them. We have Professor Katherine Marshall, is a senior fellow at Georgetown University, Berkley Center. I've been knowing Professor Marshall for a long time, and I'm glad that she has been one of my inspiration in my work. We have also Sharon Eubank from the Latter-day Saint Charities. And then we have Professor Marco Impagliazzo from the Sant'Egidio community. I think, you know, if you want to have more details, you can surely refer to the bios that have been shared in advance. And I would like to start this panel by reminding everybody that we have three main questions that we will be referring to in this conversation, and I will ask all the speakers to answer one question each. We will start now with the first question. The first question is, how can FORB help address the COVID-19 pandemic and help build back better? Now, I will ask Professor Katherine Marshall to provide us with a short answer to this question, 2-3 minutes maximum. I repeat, how can FORB help address the COVID-19 pandemic and help us build back better? Professor Marshall, the floor is yours.
Good morning, good afternoon. Delighted to be with all of you. The religious links to the COVID pandemic have been much more obvious from the very beginning than in for example, the Ebola crisis or many of the other pandemics for a variety of reasons. But the focus on what we mean by the religious involvement, I think, is the center of what we're discussing today. So clearly, FORB, which means freedom of religion or belief, the issues around persecution, issues around bias, restrictions have been quite prominent, but I think they should be set in the broader context of religious engagement, which means understanding how religious institutions are involved in society and specifically in healthcare and in providing for the most needy, the poorest members of society. And that requires something that we call religious literacy or religious sensitivity. In other words, that there are bridges, clear understandings between public authorities in country after country at the UN level, in multilateral institutions, and the vast, complicated world of religious institutions. So there are many ways, and we've been tracking that. I'll put that into the chat box on a daily basis, exactly how this is involved. But first of all, it's involved gatherings of religious communities. Secondly, religious practices, different kinds of practices. I think the one we're focusing on here most is the extraordinary mobilization of religious institutions to respond to the needs of those who are suffering, the most vulnerable, people who are hungry, the disabled, the refugees, all of those issues. Religious institutions also have a specific responsibility for something that is common to all pandemics through history, which is a rise in discrimination and looking for scapegoats. And finally, the point that Simona emphasized, as we think about building back better, about making a better world, once this phase is over, religious institutions need to be at the table.
Thank you very much, Katherine, for setting the frame for this conversation, and then for linking the issue of FORB, of freedom of religion and belief, to the engagement of faith-based organizations in the fight against COVID-19. I will now ask Sharon Eubank to provide me also with a short answer to this question. Sharon, the floor is yours. You have 3 minutes.
Thank you very much. I had a death in my family this week, and I was thinking about the stages of grief and how similar it has been to what we've gone through in the pandemic, because it begins with this disbelief of how can this be happening? How can our lives be altered? And then it goes into anger and competition, and all of the behaviors that we don't want and don't like about the ways that we sometimes feel, but that come out when we feel tension and stress and competition. But hopefully, as we work through those, we get to this stage that Professor Marshall was talking about the shared humanity, the things that we can do for each other, and the absolute truth of the recognition that we cannot thrive without each other. I would just offer to this answer just probably one thing. When we are trying to get to that stage, and everyone comes to it at a different place, and so we're always trying to help each other move along that better spectrum to get to the acceptance and the productive ways to deal with it. Really is like death and grief, that we're dealing with that on a global level, which is very unusual. It's only happened once in our lifetimes. But there are 3 things that I think can, if we talk about build back better, I think something that are helpful, that are specific to religious organizations. And the first one is, it's possible for faith-based organizations to help identify and strengthen those entities that are working against the fear-mongering, the scapegoating, and provide and promote these positive mechanisms for us to move people along that spectrum. And I think they can also help identify those who are scared and are acting out, and speak to them in language that they can understand, and challenge them to step up and learn a little bit more and have examples of leadership. But in order for faith and religious organizations to play these roles, they have to be invited to the policy table. They have experience, they have wisdom in building bridges and weaving nets, and they are unique to religious organizations and faith-based groups. And we will need that in the Build Back Better. I don't think the world will ever go back to the way it was. We want that. But that normal, I don't believe, will ever come completely back. And we are forever altered as a society. And we cannot travel back to that new horizon without a spiritual compass. And so the topic today is very timely. It's relevant to everybody here. And I'm eager for the discussion. Thank you.
Thank you. Thank you very much, Sharon. And thank you in particular for highlighting the very important role that FBO play in promoting positive values and engaging people at the grassroots, in particular to fight the fear mongering and the hate feelings that have been going on during the last months, and the importance also to invite this FBO to the policy table. I will now ask Professor Marco Impagliazzo to also provide me some insight about the same question. Professor Impagliazzo, the floor is yours.
Yes, thank you. Good afternoon. And faith-based communities have played and are playing a vital role, according to my experience, in protecting lives and downgrading the multifaceted consequences related to COVID-19. They have the possibility to rebuild better, as you asked in the first question, in developing a bottom-up process of protection and recovery. That means that the first response to the COVID-19 crisis has to be concentrated on the most vulnerable people. The experience of Sant'Egidio, for example, shows that you can reach everybody when you start from the bottom. Or as Pope Francis often says, you better understand the center from the peripheries. I will share also a second experience during the pandemic crisis, is the interreligious cooperation. Was crucial, this interreligious cooperation. I will say in Italy, but also in many countries in Europe and abroad, in promoting common and interfaith collaboration in prayer aimed to peaceful coexistence, because we have this problem in our society now due to the economic crisis. United States shows this problem very clearly in this last time, the peaceful coexistence. For example, the proposal for a worldwide day of prayer and fasting, May 14th, made by the Higher Committee of Human Fraternity with the support of Pope Francis in order to implore God to help humanity overcoming the coronavirus pandemic, was an example of this cooperation. And our community of Sant'Egidio, with convictions, endorsed it. Thank you.
Thank you, Professor Impagliazzo. I would like to highlight really the need of focus on the most vulnerable people in the fight against the COVID pandemic, and also the element of the interreligious cooperation that you stressed, and the 13 May Day of Prayer that was called by Pope Francis and Al-Azhar. This is something that also the Secretary General of the United Nations has very much valued and spoke about with very good words in the last weeks. So thank you very much for raising these very important points. I will now go back to Professor Katherine Marshall with the second question, which is slightly more practical. Professor Marshall, I would like to ask you, you know, if you can provide us, if you can say a couple of words of what is the added value of faith-based organization in the fight against the COVID-19 pandemic. And in particular, if you can provide us with a lesson learned or a good practice by humanitarian FBOs that have been involved in the fight against the pandemic, or maybe by another important stakeholders in collaboration with FBOs. Professor Marshall, the floor is yours. You have 3 minutes.
From the beginning of this pandemic, when it was first recognized as a global issue, there's been an effort to say, what did we learn from previous pandemics, going back to the plague, leprosy, but more recently, Ebola and HIV/AIDS, Zika. And I think one of the frustrating things is that the many efforts to draw lessons from these experiences from the religious side have not clearly been taken well into account. And it's encouraging that WHO, for example, the World Health Organization, is making deliberate efforts now to look at the health activities of religious organizations, trying to translate some of the basic messages, wash your hands, stay at home, into terms that are understandable, but also to bring in the networks of religious hospitals and clinics that are a fundamental part of health systems, particularly in the poorest, most forgotten areas. So I think that this importance of the health side has been an early focus, and it's not all positive. There have been disagreements that turn around the rights of governments to restrict religious practice, religious gatherings. There have been tensions in a number of parts of the world. But what I think we're most interested in, and what we see as the area where we really need to bolster and to support these efforts, is the extraordinary mobilization, whether it's food banks or actions in refugee camps, mobilization of finance to people who don't have enough to buy food, the focus on the handicapped, on the disabled, all of these which are at the essence of the mission of a lot of religious communities is very important. And I think that Marco will probably comment on this, but there are many conflicts in the world that have religious overtones or religious dimensions, the bitter conflicts. And the question is, how are institutions responding to these, both the threats, but also the changing realities that come with with this? We're particularly worried about the situation of refugees, the 80 million forced migrants in the world who barely get along with previous funding, and the funding is cut back. So these are areas where the religious communities, this religious engagement that I referred to, has such vital importance, and we need to carry that awareness into action.
Thank you, Katherine. Really, I can't but agree with you on the lessons that we can all learn from the health activities of the religious clinics and hospitals, especially in the poorest and most remote areas in the world, and the importance of the mobilization as the essence of the missions of many of the FBOs, especially those who are serving the most marginalized groups, including, as you mentioned, the refugees in unfortunately many parts of the world. I will now give the floor to Sharon Eubank. Sharon, please, the floor is yours.
Thank you very much, Simona. I'm not an academic and I'm not a policymaker, but if you'll allow me today, I thought I would bring a specific, very practical example that might show some of the lessons that we're learning out of this just from the work of Latter-day Saint Charities. So I brought some pictures to show. You know, in mid-March, the two hospital systems in the Western United States, very large hospital systems, like a lot of other places, they were recognizing that they had a critical shortage of personal protective equipment. And prices were skyrocketing at that time. There was a lot of fraud, and suppliers were restricting their exports. And these hospital systems use 85,000 masks and disposable gowns every single day. So they were just faced with this dilemma, and they knew they had to do something innovative. The infection control portion of the medical school designed patterns of gowns and masks, and they sourced fabric, but they were stuck. They didn't know how to get that fabric. They didn't know how to ship it. They didn't know what to do with it when it got here and how to get the sewing done. So they came to Latter-day Saint Charities, which is the organization that I represent. And they said, can you help us make PPE, personal protective equipment? Nobody thought about doing that. Everyone was trying to buy it at that time. So the goal eventually became to produce 220,000 isolation gowns, 6 million surgical masks, and 100,000 medical face shields. This is the scale of this is just unbelievable. At that time, it was almost impossible to purchase the masks, but you could get surgical grade fabric that came in large bolts. So we knew that we could contract the sewing to large sewing workshops and keep people employed. But in order to sew enough masks, it was going to require 10,000 people that would sew 100 masks a week for 6 weeks in a row. That's how you would get to the 6 million. And the only way to do that would be with volunteers, and there was no one faith that was able to do it. It would take a lot. So it was organized so that you could come and pick up these kits with supplies. You would take it home. You could sew 100 medical grade masks and then return it so that it could be sterilized and then deliver it to the hospitals. And we had no idea if it was going to be possible. But I'm happy to report that this week, as of today, the last of the 220,000 gowns are being delivered to the hospitals. And on July 3rd, we will collect the 6 millionth mask. Most of them are already in use in medical clinics and care centers. Some of them are being distributed in places like Honduras, where these nurses were using grocery bags. It's all that they had available. Katherine said some of these things about this. In places that have fewer resources, or communities that don't have purchasing power, or refugees and internally displaced communities that don't have good supply chains in the best of times, these are very, very valuable lessons to share. We learned some critical things, and I'll just briefly share them. The first thing is, any humanitarian project, you have to have a communication component. You're mostly trying to change behavior and work towards something more sustainable. And this is probably one of the very hardest things. People don't want to do things just because they're good for them. And there's always the distracting voices that are competing with you, or there are political messages, and it dilutes things. This project became a very vivid example about how education can result as a byproduct of becoming involved and volunteering. It's very unusual that we would use almost 1 million volunteers in a project like this. It's just too big. But the byproduct of this that we have learned is, rather than trying to convince people about these messages to change their behavior, this became a natural byproduct of getting involved in this. So people were able to learn and absorb, while they were being part of this, the different kinds of masks, the hygiene projects, the kinds of sterilization, social distancing, all of those things that were important, and that became part of the natural process as they volunteered. This becomes important because these tens of thousands volunteers later on, when communities start having discussions about how are we going to congregate safely for worship and other things, how are we going to adapt our religious rites, these people who had volunteered, they were the ambassadors to some of this public health good practices, and that was very helpful. Also, while faith communities may not be as connected to each other as they could be, this project created a forum, although it was a digital forum, for people from different faith communities to come together in this community and work on something that they had in common. We learned that if you put a bare infrastructure in place, This is an example of Facebook and WhatsApp groups that were stood up. Usually we would use a community center to do something like this and try and bring people in. But in this case, we had to create a digital community center. And I learned that if you create something like that, the volunteers themselves will learn how to use it. You know, somebody asks a question, are there more kits to pick up? And then there are resources that were stood up here. It creates a social fabric that can potentially be leveraged later on to tackle other difficult problems, such as the rise in domestic violence or food insecurity that's going on, or the economic fallout that's being brought by those things. So I bring up this example because it created tremendous learnings for us from this community. And now similar projects have been stood up in places like the Philippines and Paraguay and Mozambique and Mexico and Brazil, with these abilities to bring communities together that wouldn't naturally come together. And so I share something like this as an example of some of the things that we've learned that we would not have learned if we hadn't been involved in a global pandemic. Usually you have hotspots, but in this case, there is no community anywhere on the planet that isn't dealing with economic fallout, food insecurity, or health issues. So this was very, very helpful to us, and I just share some of that. Thank you for watching my pictures.
Thank you, Sharon. It's amazing. Really, I think that this case study that you show us really speaks to the importance of really goes to what people can do and achieve when they work together. And also, you know, what really impressed me, what really struck me, is the learning and the education and behavioral change that has resulted from this process of volunteer and interreligious collaboration. So kudos to you and to your colleagues who accompanied you in this process. Thank you very much. And then I will now give the floor to Professor Marco Impagliazzo. Professor Impagliazzo, the floor is yours.
Yes. I will say as a premise that in the time of lockdown, a lot of faith-based communities have not closed their doors. This is the first thing that I would share with you. And faith-based communities were instrumental in reaching the most vulnerable with assistance, health information, as Katherine was saying before, and identification of the primary and more urgent needs, like food, for example. Immediately after the beginning of the lockdown, in our experience in Sant'Egidio, we adapted our services, for example, of soup kitchen and food distribution, focusing on the people with no shelter that were forgotten by the authorities since the very beginning. You can see a lot of homeless alone in the streets of our cities. And with these homeless, there were the presence of our volunteers or volunteers of different faith-based communities. The food distribution in this time have been multiplied. I will say for 3, for 4 along all the lockdown period. It is still very high because of the economic consequences of the pandemic. In this respect, Sant'Egidio also advocated for the needs of the most vulnerable towards the public authorities. There is a question from a friend, Christian Morelli. Yes, we advocated for the needs of the most vulnerable towards the public authorities, and we obtained a more wide distribution of food, vouchers, and other form of immediate help for people in need. And then a second thing is that all these communities have adapted worship and meetings to the new situation, not only by observing appropriate physical or social distancing but by boosting social and other communications media and social media in order to create a global contact network. Using new technologies was essential for keeping the community connected, but also for reaching and helping others. And as Katherine Marshall, the third thing I would underline, as Katherine Marshall was saying, we share health and prevention information to protect not only the member of our communities, but including also an extensive community outreach. This is very important because in some situation, we took the responsibility, all these, a lot of these faith-based communities took the responsibility to communicate how to prevent COVID-19 contagion, providing essential information in countries where the public institutions were not willing or prepared to do this. This was also significant in the cases where it was and still remains essential to reduce fear and stigma. I was thinking to Africa, for example, to provide encouragement to people and endorse health-saving practices to implement the preparedness of the people. So we create a system of communication in order to spread all the prevention information. But I come back to the second point, also to spread the gospel or the word of God, to help to pray together. We observe the physical distancing, but thanks God, the new technology helped a lot for keeping the community connected and reaching and helping others. Thank you.
Thank you very much, Marco, and thank you for sharing with us the example of the work of Sant'Egidio with assisting to the most vulnerable and the most marginalized. First of all, with providing food. You mentioned the soup kitchens and the distribution of food to the homeless, but also to bring this a step forward and advocate for the improvement of certain services with public kind of authorities. And then let me also highlight something that was mentioned also by the previous speaker, the use of new technology. Like, I think this is something that in these last 3 months we've all realized. It really brought our work a step forward. Without the new technology, we wouldn't be able to connect now and discuss in this webinar, but we wouldn't be able to do a lot in terms of providing aid and assistance to the most vulnerable. So I think we are in a very in a phase of our lives where we are realizing that there has been really a life shift, and that things will never go back to where we were before in terms of communication and information sharing. And I think finally the new technologies are showing their more human face, and we really hope that we will continue to make the best use of this technology to really be able to leave no one behind. Mindful of the time, I would like now to go back to Professor Marshall and ask her the last question. We have already heard a lot about partnership and solidarity, and of course, you know, during these 3 months, these have been probably the main buzzwords that we have been hearing every time, that there is no final solution to the COVID-19 if we don't work together, if we don't raise the level of world solidarity. So my last question, starting from you, Professor Marshall, how can we use partnership and solidarity? How we can improve partnership and solidarity in our common fight against the COVID-19? Professor Marshall, the floor is yours.
I want to start with something that's a little bit less heartwarming and positive, which is the concern of a number of organizations that when partnership is mentioned, first of all, it means that he who pays the piper calls the tune. In other words, the sort of power relationships that are involved. But more this word instrumentalization, the temptation to, quote, use the religious communities because there's higher trust in them. So what is important, this question of being at the table, is listening and engaging so that there is a genuine appreciation for the knowledge and the wisdom and the contacts and the networks that these organizations have. So I think that's one important lesson, both from the past and for the future, that this is not just about, as someone says, you know, add religion and stir. It is about a change in mindset so that there is an understanding of these vast communities. So the question of coordination and partnership, which is a perennial for all of us in life, but above all in humanitarian and development work, has come starkly to the fore. First of all, that yesterday I was involved in a discussion about debt issues and the issues of the debt standstill. And what was extraordinary was that every issue you can imagine came onto the table: military spending, child abuse of children, trafficking, colonialism, etc. In other words, water, going back to school, food banks, universal basic income. All of these issues are so tightly connected that trying to move them into silos is a serious problem. And all of the organizations need to work together. Now that's easier said than done. And we're seeing some strong leadership from some of the big interreligious communities, Religions for Peace, CAICID, URI, Universal Religions Initiative, and others, but also at the national level. But what we're hearing most of all is that it is at the community level that people are coming together, not caring what their religion is, whether they're religious or not, whether they're public or private, whether they're private company. A wonderful example is in Geneva, where there has been a massive mobilization to support refugees, which is many different segments of the society coming together. And we're hearing that in Bangladesh, in Pakistan, in Peru, in Mexico, all over the world. You're seeing this. And I think we need to figure out how to build on this energy and this inspiration that does touch what I think Sharon mentioned in the beginning, which is this sense of common humanity.
Thank you very much, Katherine. You know, I think you made three main important points. That this is really that these signals are changing mindset first and foremost, and then you know that we have really very good practices, including from FBOs like CAICID and like Religions for Peace and URI, but many of the best kind of examples come from the community, where we see a mobilization that never seen before in the past, and that we need to learn from these examples. I will now give the floor to Sharon Eubank. Sharon, the floor is yours.
Thank you. I've thought a lot about supply chains, because all of the supply chains that feed the consumerism around the world have been disrupted. And yet I've been amazed to see how people have responded to that by doing things that they've never done before. So you see restaurants offer food in a different way, and you see stores offer groceries in a different way. And all of us, you know, here we are on a Zoom call, you know, we're doing something different rather than traveling to do things. And it happened relatively quickly. In 3 months, we have quickly adapted to this disruption in the supply chain. I think about the communities that are the most vulnerable, who do not have access to supply chains. And I don't just mean in physical goods, but I mean the supply chain of goodwill among disparate groups in the community, and the supply chain of respect and listening that Katherine talked about. We have the ability to disrupt those supply chains and find new ways of partnership and connecting. We've just shown ourselves that we can do it in a 3-month period of time. It doesn't take years and decades. And if we would do that, if we would take as our customers the most vulnerable in this society and be as concerned about those who are suffering a slow pandemic death because of poverty, because of lack of education, because of lack of healthcare, because of restrictions on their freedom, if we would take that on, I think the partnerships and the innovation that would be created from that would surprise us. And I'm committed to it myself, to look at things and partnerships in a new way, and to seek out new cooperations and listen and confront my own biases that have been brought forward, and see what can be done. That's my plea to this group today.
Thank you so much, Sharon, to bring in this case of the of how we should really try to learn better from the changes or disruption of the supply chain. The last speaker, last but not least, to answer this last but not least question, is Professor Marco Impagliazzo. Professor Impagliazzo, the floor is yours.
Thank you, Simona. I would stress the aspects of the economic downturn caused by coronavirus pandemic. We know that we are facing a global, unprecedented emergency, not only worldwide, but also long-lasting. It's not clear yet when the pandemic will be over or the vaccine available. The economic devastation, let me use this term, is likely to be long-term. As faith-based communities, we have to organize for a long period, building our faith-based approach not only on fundraising, but also on the voluntary work and on the free offer to help. One of the findings of this crisis is that there are a lot of people prepared to help, more than we imagined before. That was a very important point for us, for example, in Italy, but not only in Italy, in our experience, global experience of Sant'Egidio community. Second point is, it is not only a matter of economic support to our faith of communities. Today, more than ever, is essential to answer together. Government, local authorities, FBOs, faith communities. The authorities should pay more attention to the vast amount of experience that we have, and think of a shared response. Our communities should be ready to share their knowledge, as we are doing now. It is very important, this webinar, because we are open new link, new sharing our knowledge. I would share with you just a point, a last point, because the time is over, and about this service of telemedicine. Is a crucial service that we did in Italy, to make possible for everybody to speak with volunteering doctors and medical staff, considering that the public medical and health system was under stress and mainly inaccessible. This for very, very useful. And the last point is the situation of the elderly. So you know that we were particularly concerned about the sad situation of the elderly in nursing homes and hospices. As stated by WHO, half of the deaths by coronavirus were old people in that kind of institutions. The global tragedy of mortality among the elderly clearly represents what Pope Francis calls the culture of waste. And in different Western countries is emerging a dangerous model that favors selective health care, which considers residual the life of the elderly. So Sant'Egidio advocates with an international appeal addressed to all citizens and institutions for a decisive change of mentality, leading to new initiatives, both health and social, towards the elderly, called this appeal, "There is no future without the elderly." Mm-hmm. We will be very happy if you could sign it and help us to spread it elsewhere. Thank you.
Thank you, Professor Impagliazzo. I think you made very, very important points, starting from reminding us that this is going to be long-term. This is not going to end tomorrow. And then we really need to prepare ourselves to join hands. In this, I'm referring to what we also call at the United Nations multi-stakeholders partnership. And then also, thank you very much for reminding us that the burden of this pandemic has been carried by the most vulnerable, including the elderly. And I would like to remind here that no young life is better than old life. That we are all in this together, and that we have to join hands to work together and make sure that, in particular, the lives of the most vulnerable people are protected, the life and the human dignity. I think I would now like to dedicate the last 15 minutes to the Q&A question, to the Q&A session. I saw that there are a couple of very interesting questions in the chat box. I would like to start with this one. We have a question from Timbarashe Munamati from Zimbabwe to Professor Marshall and Professor Impagliazzo. And he asked, how can we correlate religious antagonism among the FBOs, which can be an hindrance to effective response of FBOs to COVID pandemic? I will repeat, how can we correlate religious antagonism among the FBOs, which can be an hindrance to effective response of FBOs to COVID-19 pandemic? Who would like to reply to this question?
I can start if you like. My sense is that, in fact, there's a great deal of cooperation among most of the religiously linked organizations that are involved in humanitarian and development work. There are a number of platforms, there are a number of efforts. The main issue is often competition, and particularly because funding is often so little available that organizations spend time positioning. But I think there are wonderful cases of very unlikely collaborations in Haiti and Asia and many different places. And likewise, the global interreligious organizations that I mentioned before have been very active since the beginning of the pandemic, as have local communities. But that doesn't mean that the issue of tensions among religious communities are not there. They are probably less obvious in this sector, in the kinds of matters that we're talking about, which brings people together. That's one of the exciting things about development and humanitarian collaboration, is that there is such a strong shared ethic of humanity, of caring for those who are most vulnerable. It sometimes comes down to a question of what's the best way to do it and who is best placed to do it. But I think we should not ignore what I think the questioner is alluding to, which is that there are a lot of tensions. Take Nigeria, Central African Republic, Myanmar, where I think we can argue that it's not really about religion that people are in conflict, but there clearly is a religious identity, and that puts a tremendous premium on the peace-building roles of the religious organizations. Sant'Egidio is one of the remarkable organizations involved in this, but there are a number of others that are trying to deal with these tensions and conflicts. And just to finish, I think they coming together to support the people who need help, whether it's refugees or children or vulnerable communities or the elderly, is one way to bring out the humanity, which maybe can overcome prejudice and discrimination and therefore conflict and tension. And Simona, you obviously, this is your life. You spend your time working on these issues, but it's interesting to try to sort of link the issues we're talking about today, which is the actual religious roles in mobilization, with some of these broader issues that we're very worried about at the global level of what's happening with conflict, all the way from terrorism to civil war to domestic violence, which we know is on the increase, abuse of children, all of these other issues that are things that we wake up thinking about in the middle of the night because there's so much on our minds.
Yeah, thank you very much, Professor Marshall. Maybe Professor Impagliazzo, do you want to add anything?
Yes, can you hear me? Yes. Okay. Yes, thank you for the question. Antagonism is the opposite of an effective response to pandemic, because as Pope Francis said during the Holy Week, we are in the same boat. So we should row in the same direction on this same boat. This emergency was a common call to a shared responsibility. And in our experience, I thank Katherine to quote this, of interfaith, interreligious dialogue, this experience has prepared us to give a common answer to the question of this pandemic. So I think that we should row in the same direction, and the antagonism is to, we have to put apart. And in this sense, the fact that we have prayed together with this the Human Fraternity Committee, Pope Francis, and a lot of different communities during the pandemic was an important sign of this change also in the interreligious relationship.
Yeah. Okay. Then I see here, I would like to raise two more questions here. One that is very dear to me, if I may take this opportunity to be a chair here. I read a question from Gabrielle Cunningham. She's asking, how can FBOs help combat fake news and anti-scientific attitudes that may be present with their congregations and communities? And then maybe the last one, if we have time, I think that we have a couple of more minutes. What is the contribution of businesses community to help the poor and needy? From Surendra Pachauri from New Delhi. So one is basically on the role of FBOs to combat fake news, or maybe misinformation. I prefer this word, and hate speech and anti-scientific attitudes. And the second one is the role of private companies and business communities. Maybe can we start from Sharon?
I'm interested in this idea that has been asked about of how do religious communities combat some of those difficult misinformations among their communities. I believe, from my own experience, that people don't really change their minds because of what they hear. They change their minds because of experiences that they have. And so at the root of this question, because people have different beliefs based on their experiences, I think we have to expose people to new experiences. And that's what religious organizations are well suited to do. If we will employ the ability to not rush to judgment and to not polarize everything and to not demonize everybody, but to really listen for understanding and to engage with one another in ideas that we may not yet believe, but may come to an understanding. So I am always looking for opportunities that I can go be with somebody else in their reality and try and experience them, or to invite them with me and have some kind of an exchange. If we can do that exchange, then we can take the next step into combating misinformation and some of those other things that are so destructive to our communities and our inclusion of each other.
Thank you, Sharon. Professor Katherine Marshall.
This is a very important issue, and it's important particularly because in a pandemic like this, the role of public health and their desire for simple messages is so important, you know, stay home, etc. And first of all, those messages may not be understood by people, so religious communities, religious leaders can help to translate them into terms that people can understand, but they also, and this is as important, can help to help the public health people understand that they need to be adapted. The no-brainer here is that people who live in slums can't stay home, that you need to adapt some of these very basic public health messages. The issues of hate speech and misinformation that go beyond sort of honest misunderstandings into distortions is an important one. Some of it does have religious links. In other words, specific religious communities are spreading certain kinds of information, that there is no pandemic, for example. And that, I think, is best dealt with within the religious communities themselves. And the same applies to some of the tendencies to look for somebody to blame, which is very human, but very dangerous. And people are afraid of the shame. And so it is, I think, very critical that wise leaders at every level really take on within their own communities and those that they know ways to find out why people are saying these things, but also to deal with the fears and the hatred and the anger. And we really do rely tremendously on these communities, because it can't be done by fiat. It needs to be done, as Sharon is saying, by trying to understand better where it's coming from and to communicate about it.
Thank you, Professor Marshall. Professor Marco Impagliazzo?
Yes, just one word. Faith and culture goes together. This is, I know that it is difficult to understand in some situation and also to put in practice in other situations. So the question is very, very important. In our experience, in Sant'Egidio experience during this pandemic, we have fight against fake news one by one, using our web, our all the system, possible systems to help our members, especially in some countries, to avoid the traps of fake news. This proved to be very effective in sharing information of personal protection and social distancing, for example. So is a fight. Is a fight to put together faith and culture, and this pandemic will help our communities to gain this fight. I think this is one lesson, very, very important lesson to FBOs. Thank you.
Thank you, Professor Impagliazzo. I am just posting in the chat box the UN guidance on countering and addressing hate speech related to the COVID pandemic. So this is a document that has been launched on 11 May by my office, and that follows the call, the global appeal by the Secretary General to combat hate speech and misinformation related to COVID pandemic. So I think that this is a very useful document, including because it calls various stakeholders, including the religious leaders, actors, and FBOs to contribute to this common effort. So we are just a minute after the time of closure. I think this has been an amazing discussion. I thank all the speakers and the participants for spending this hour with us today. And I will give now the floor back to Francesco De Lillo. Francesco.
Thank you very much, Simona, and on behalf of the sponsoring institutions, thank you all for being with us. To our panelists, it has been a very interesting and wonderful discussion to hear and participate in. So let's give a virtual round of applause to our panel and the hosts that made this possible. It's at this point, I'm happy to announce our next two webinars. Registration on our landing page will open soon for episode 13 next week, July the 2nd at 3 p.m. This webinar will focus on the United States, Canada, United Kingdom perspectives. We will be pleased to have Mrs. Nadine Maenza, Vice Chair of the United States Commission on International Religious Freedom, Ms. Tamara Maywini, Minister Counsel and Deputy Permanent Representative at the Permanent Mission of Canada to the United Nations in Geneva, and the Honorable Rehman Chisti, Prime Minister's Special Envoy for Freedom of Religious Belief for the United Kingdom. And because all things must come to an end, the 14th and final episode of our webinar series is scheduled on Thursday, the 9th of July at the same hour. We will be looking back at the series, and we invite all of you to join us and share our reflections on what we have learned on COVID-19, religion, and belief from so many experts from around the world. So we invite to keep an eye on our landing page, or if you have given permission to send you emails, look for the upcoming invitation for more details. So although we cannot see you all, we appreciate your support throughout the series, and we look forward to welcoming you next Thursday, and have a wonderful day. Thank you.